My name is Crystal Walcott, Mass Media Campaign Officer for the Barbados Childhood Obesity Prevention Program for the Heart&Stroke Foundation of Barbados, and I will be sharing some key updates from the survey we would have done, as Francine would have mentioned. Okay. The Octagonal Warning Labels Save Lives campaign was conceptualized to position the introduction of octagonal warning labels as the best nutrition warning system to help persons easily identify what nutrients are in their foods, specifically in excessive of sugar, sodium, and fats. This follows Barbados' health policy work so far, which has seen the sugar-sweetened beverage tax at 20% and the implementation of the National School Nutrition Policy. The introduction of the labels would be a key strategy aligned to the PAHO nutrient model, which supports our work to address childhood obesity prevention. With 80% of deaths caused by non-communicable diseases, the campaign also sought to raise awareness about the impact of ultra-processed products on our diets, which have contributed significantly to the NCD crisis we face in Barbados today. The study was done between August 2024 and September 2024 with a sample size of 602 Barbadians. This was a nationally representative survey, which is one that has a strong enough similarity to the general population for the results to be deemed valid. Key demographics used were age, gender, and parish based on the 2021 Housing and Population Census. A multi-stage sampling approach was used to determine the sample of the study. Research objectives. So the study had a few key objectives, which included campaign recall, gauging public support on health risks associated with consuming ultra-processed products, to evaluate the effectiveness of implementing the labels, and gauging the level of public support for the introduction of octagonal warning labels. So in 2022, as Francine would have mentioned, we conducted a study to identify support for front-of-package warning labels in Barbados, to which we got 75% support. Following this study, we have 93% support for the introduction of octagonal warning labels in Barbados. As it relates to obesity prevention in children specifically, this is significant because the labels will help parents, schools, and even children themselves identify what is in their food quickly and easily. 9 in 10 respondents show support for campaign ads petitioning for octagonal warning labels to be included on ultra-processed products. Persons are therefore interested in receiving education about how they can be better and how the environment can be improved through policy, which is a good sign of the advocacy and awareness efforts, not just by us, but by civil society, our coalition, and champions of messaging for the introduction of octagonal warning labels. Another finding of interest was that persons who were unaware of the campaign messages found it very to somewhat easy to read the current nutrition panel. However, those who were aware of the campaign found it difficult to say the same. And this speaks to the effectiveness of the labels in easily and clearly helping persons to identify what is in their foods. 82% of respondents aware of the campaign ads were more likely to agree that ultra-processed products were unhealthy. This shows the impact of campaigns like this, as well as the campaign we would have run before, Give Us Warning Labels, because they're playing a role in raising awareness about the dangers of ultra-processed food products, which can therefore plant seeds for positive behavior change. There was a strong concern for health emerging from the survey results. The campaign played a role in highlighting the health effects of ultra-processed products, as I would have mentioned, UPPs. Those who were aware of the campaign therefore agreed that these were unhealthy. 80% of respondents were concerned about the health effects of UPPs, 74% about consuming them, and 67% were even willing to reduce their purchases. 40% of respondents in this survey were parents. Those who were aware of the campaign, which was 36%, were more likely to consider the harms of consuming ultra-processed products by their children. The growing concern therefore calls for direct nutrition information for parents to make educated decisions about the food that they give to their children. And Octagonal Warning Labels allows for just that. So just to tie everything together nicely, we are proud to share that 93% of Barbadians support the introduction of Octagonal Warning Labels, which can make a difference in the lives and the health of our children. Currently, we have 31% of our children overweight and obese. It takes 10 seconds for most shoppers to identify if they will purchase a food product. Labels saying high in sugar, sodium, or fat could be easily read by parents, schools, and again, children themselves to make an educated decision on what foods to give our children. Thank you.